The aim of the unit is for learners to understand the health and safety responsibilities within their role for safeguarding staff and service users. Health and safety is an essential consideration for all practitioners in health and social care, and this unit will enable learners to develop an understanding of the importance of continually monitoring the implementation of health and safety legislation and policies within any health and social care setting. Hazards and risks. A hazard, as defined by the TUC, is something that can cause harm, and a risk is the chance, high or low, that any hazard will actually cause somebody harm. Identify the hazard by carrying out a workplace risk assessment. Determine how employees might be at risk, evaluate the risks. Record and review hazards at least annually or earlier if something changes. Responsibility and liability are shared between employer and employee. Accident prevention and protection from harm are key responsibilities. Explain the legislative framework for health and safety in a health and social care work setting. Current health and safety legislations 020300405. Health and Social Care Act 2008, Care Standards Act 2000, Mental Health Act 2007, Disability and Equality Act 2010, Children Act 2004, Child Care Act 2006. Systems, policies, and procedures include health and safety management systems and standards, health and safety policies, and application, health and safety procedures, implementation, responsibility, and training. The Care Quality Commission is an executive non-departmental public body of the Department of Health and Social Care of the United Kingdom. It was established in 2009 to regulate and inspect health and social care services in England. The Control of Substances Hazardous to Health Regulations 2002 is a United Kingdom statutory instrument which states general requirements imposed on employers to protect employees and other persons from the hazards of substances used at work by risk assessment, control of exposure, health surveillance, and incident planning. The Food Safety Act 1990 is an act of the Parliament of the United Kingdom. It is the statutory obligation to treat food intended for human consumption in a controlled and managed way. The key requirements of the Act are that food must comply with food safety requirements, must be of the nature, substance, and quality demanded, and must be correctly described, labeled. The Personal Protective Equipment at Work Regulations 1992 are a set of regulations created under the Health and Safety at Work, etc. Act 1974, which came into force in Great Britain on 1 January 1993. The regulations place a duty on every employer to ensure that suitable personal protective equipment is provided to employees who may be exposed to a risk to their health or safety while at work. This regulation requires employers and others in control of workplaces to report and keep records of work-related accidents which result in death, work-related accidents which cause serious injuries, reportable injuries, diagnosed cases of certain occupational diseases, certain dangerous occurrences with the potential to cause harm, and gas-related incidents. Employers have the responsibility for health and safety in a setting as defined by legislation. This includes training of staff, provision of safety equipment, and ensuring compliance with new legislative requirements. Employees must follow procedures, work safely, and report any issues. They have a duty to take care of their own health and safety and ensure their actions do not threaten the well-being of others. Employers must make the workplace safe, prevent risks to health, ensure that safe working practices are set up and followed, and provide adequate first aid facilities. Employers must ensure that all materials, substances, and equipment are handled, stored, and used safely. They must inform employees of any potential hazards and set up emergency plans. Employers must check that the right equipment is supplied and is in working order. They must provide protective clothing and equipment, ensure warning signs are provided, and report certain accidents, injuries, diseases, and dangerous occurrences to the local authority. Employees must take care of their own health and safety and make sure that they do not threaten the well-being of others. They must cooperate with their employer to attend training sessions and properly implement any policies they draft. Employees must not misuse any health and safety equipment that is either given to them or part of the workplace, such as personal protective equipment or fire extinguishers. They must report any injuries or illnesses in the workplace. An employer should not request that a staff member carries out a job that they have not been trained to do. An employee who is given a work activity must be competent, which means that they have the right amount of knowledge, training, and experience to do the work. They also may need to be supervised for a period of time to be deemed competent in specific tasks. If a person is requested to carry out a work activity and they do not feel competent, they must inform their manager and not do the task until they are trained. In conclusion, maintaining a safe environment is a shared responsibility that requires continual attention and cooperation. Thank you for watching this video. If you have any questions, please contact us on WhatsApp at 07000 484 300 and 61688.